Thank you, Heather Evans, Dr. Heather Evans, for talking to us today about wearable computing technologies and their role in surgery.
Sure, it's my pleasure to join you. Thank you for inviting me.
Can you give a quick demo of how
Oh,
how
sure.
things works? And
Yeah, I've got them right here. So, like I said, they're just like a pair of glasses. Just put them on, and you'll immediately notice that, like I said, they don't have any lenses in them. I mean, I'm touching my eye, right?
uh,
There's no lens right here.
but
Um,
you can put in a lens for eye
you
protection, right?
can
Hmm.
you can put in a lens, and the original explorers got not only a sunglass shade, so that they look like sunglasses, but we also got a clear lens with the unit. Now you have to actually purchase the clear lens separately. Now that they have the second wave of explorers, so we were happy. We got all the fun tools in the beginning. So you can see that it doesn't sit like here in front of my eye. It actually sits somewhere between the eye and the eyebrow.
Hmm.
And this titanium frame here is supposed to essentially line up with your eyebrow.
Hmm.
Um, on glass, you can see right in front here, there's a camera. And this is video 720p and still photography. It's about 5 megapixel. On the side here, there's a touchpad, and the touchpad allows you to control it either by tapping or sliding your finger back and forth or up and down.
Okay.
The battery actually lives back here, and also back here, right behind the ear, is a bone conduction speaker. I personally feel like this is probably the weakest part of the unit because the audio fidelity is at best okay. It's never really wowed me. And in a loud room, you actually have to put your finger in your ear to be able to hear, because it's conducting through your skull and not going straight into your ear. With the latest version, they're now offering an earbud that will actually go. There's a power port right here. It's a mini USB, and the earbud will actually plug into here. And in the next version, they're talking about having stereo earbuds, because they want to integrate with Google Play and all the songs that you can purchase through Google.
Cool.
Um, on the inside of glass, I'm going to just take it off for a moment to show you. There's actually, I think you can see right here, there's another camera on the inside. And that other camera is purportedly so that we can use eye movement to control the device, but that hasn't been unlocked yet, so to speak, with the updates that we've had. So that's essentially the device, and it does have, in addition to the camera, and what you can't see is it has a gyroscope and an accelerometer, so that and a Wi-Fi and Bluetooth antenna, so that you can communicate directly with your phone. So the way that I'm going to demonstrate this is that I'm going to show you what I see in my Prism screen that sits right here above my eye, by Bluetoothing to my phone. So
Okay.
this is the screen. Can you see that okay?
Yeah.
Okay, so right now all I see is the time, and then there's that magic phrase that allows me to essentially unlock the device and bring up a menu. So I'm going to say, okay, glass, and you can see that suddenly there's a menu there of all these different things that I can do. One of the simple things you can do is to do a search. So I'm going to harness the power of the internet and say, Google, how tall is the Space Needle? And what you can't hear is that in my ear, through that bone conduction speaker, it said, the Space Needle is 605 feet tall.
Wow.
And there are a lot of other things that we can do, like I can translate something from English to another language, and it will say it will pronounce it for me.
Wow.
in my ear.
It looked like the menu was moving with your head going up and down too. Was that the
Yeah,
case? Was
it
it
does.
scrolling? Okay.
Yeah, it scrolls based on your head position. And the other way to wake up the device, so if I were to turn it off and like put it to sleep right now, if I wanted to wake it up, I can wake it up by tapping it, or I can wake it up by looking up 30 degrees.
Okay.
So other things you can do, okay, Glass, send a message. Christopher Baldwin. Hi, I'm just showing people how glass works.
Very nice. And so that is an SMS text.
Yeah,
Uh-huh.
and that just went to my husband. There he is. Oops. So those
Cool.
are just a couple of things that you can do. I think what I usually like to do when I demonstrate this is and allow somebody to wear them, I'll hold the screencast so that I know what they're doing and I can kind of take over if I need to. But I always get people to take a picture, and that always brings a smile. So I'll do that here at the end here. Okay, Glass, take a picture. And the thing that's amazing about this is that I really thought that glass was going to be some, physical barrier to meeting people, that people would be soured to it. You heard the stories about some places banning glass for nobody wanted them to come into their bar in Seattle. And living in Seattle, there are a lot of tech people, and it's just I was worried about how it would be received, but it is almost like being a rock star when you wear them out in public.
That
I mean,
that would be my
the
guess.
the reception is crazy. People walk up to me all the time and want to know what it is. Do you like it? Can I try it? And I've never had anybody say, "Oh, please put that away. I don't want to see that," or "I'm afraid of you," or I've never had any really negative interactions
Right.
about it. A lot of questions and a lot of conversation about privacy and security. And I think that that's really what we should be doing right now
I
is
want to ask
exploring.
about that. So
Yeah.
you mentioned before that doctor hesitation, questions about the doctor-patient relationship, and HIPAA requirements are a barrier. Can you touch on that?
Yeah. So I got the device in June, and I pretty much only wore it outside of the hospital till about late August because I just felt like we weren't ready for it. I brought it to work and I showed it to my colleagues, and I exclusively demoed it in my office. I just didn't feel like it was appropriate to walk around in the hospital where I think even the providers have an expectation of
Absolutely.
privacy that we don't have outside of the hospital.
Right.
And I didn't want to breach that. I didn't want to confront that. I didn't want that to be the first thing that we talked about. So
So
I kind of kept it under wraps.
you felt a bit like a camera crew walking around, right?
I did a little bit. Well, and it just seemed like I didn't want it to be about me either. I didn't want to draw attention to myself. I wanted it to be more about, well, how are we going to deal with this thing that's going to be there, whether we like it or not? And I mean, I took this to the American College of Surgeons and I told them that I had it. And I actually went to the Clinical Congress this year in Washington, D.C. at their invitation, and I demoed it on the exhibition floor at the social media booth that they had set up. And, overwhelming interest. So, I mean, I just drew quite a crowd because everybody wanted to see it.
I was
And my
part of that
whole
crowd.
yeah. And my whole point of doing that was that I didn't want the first time that all of us to see this device to be a negative experience where you're in clinic and your patient shows up wearing it, demanding that they interview you and they record the entire interaction. We need to be ready for this, because it's going to happen. Just last week, somebody told me that they saw a medical student in our cafeteria wearing glass, and I didn't know who it was. And my immediate reaction was, oh no. I'm not really sure that I'm okay with that. And I'm the one that's had glass since June.
Right.
So it's one of those things where I think we really need to be very deliberate about introducing this kind of technology into the hospital. Now, I know that there are other professionals that have glass in other hospitals that have not treated it this way. I mean, this was my choice. This was my personal choice. And I think they've been successful in integrating it into their workflow and with their patients and haven't had any adverse problems about it. But, being cautious, I don't think is a bad thing with this
Yeah.
device.
Hmm.
And it's kind of ironic that the first place that I actually used it was in the operating room in the hospital. And the reason for that, if you think about it, it's the most controlled environment we have. We know exactly who's going to be in there. We can obtain consent from the patient. They have full right to say no. I explained what I was doing to them, and I explained that I was going to record certain parts of the operation just to show that I could use the device to record, and that information was not going to go to Google, that I would be able to take the video directly off the device with a USB cable and put it in a secured place. And I've asked about 4 or 5 of my patients if they were willing to have me record the operations that I did with them, and I have not had any of them say no yet. So,
So they may be ahead of us, the patients.
well, I think they are. And it's funny, the more I read in the circles of patients and parents that have critically ill and chronically ill children and relatives, it's not so much the privacy and security that they're worried about. They're worried about the fact that we don't have the right information, that they have to repeat themselves and say the same thing over and over. Yes, these are my allergies. Yes, I've had this operation. They're tired of that. It's almost as if we are ready for this idea of a personal health record that travels around with us, that's accessible even if we're not able to communicate. And
Right. Right.
I think, as we head towards singularity, and that's not just a buzzword, I really think that that's what we're headed towards. A
Explain that.
lot of these things, well, it's the idea that there's going to be this shared consciousness because of technology, that we're not going to have to necessarily communicate with words, that we're going to be able to have information about each other that is much more freely exchanged. And I think that scares people, and it probably should scare us in some sense, because we're not quite ready to deal with the implications of what that means. But on the other hand, to imagine that your entire medical record would be available to a paramedic when they met you for the very first time when you were in cardiac arrest, I think that that would be quite extraordinary.
Right. Cool. Now you also do research more broadly, excuse me, more broadly in
Yeah.
technology, in surgical patient care and in communication, right?
Yeah, so my greatest interest is in the early detection and treatment and prevention of healthcare associated infections as it pertains to surgical patients in particular. I'm a member of the Surgical Infection Society and have been for quite some time, and so I have an intense interest in how we can improve care for patients, either avoiding healthcare associated infections or really treating them in the best way that we know how. And so I have done a number of studies using technology, leveraging technology to be able to improve early detection of things like ventilator-associated pneumonia, surgical site infection. And I'm trying to figure out how we're going to be able to leverage glass in this way, but I think we're sort of there's a bit of a gap between what we're able to do right now and what I can see in that particular oeuvre of my research. But the things that I am working on right now are to develop a mobile app that patients will be able to take home after surgery to monitor their surgical site for evidence of infection and to communicate those findings directly with the people that know them the best after surgery.
Cool.
So that's one of the major things that I'm working on right now. I've just received some money to be able some grant funding to be able to pursue that further. But I've also just put together this brain trust of a bunch of people that are really interested in glass and how we can leverage it in medical education. And we're hoping to take that example that I described of the central line placement and make modular sort of units, central line placement, maybe ventriculostomy, lumbar puncture, diagnostic peritoneal lavage, chest tube placement, all these ideas, these procedures that are, various degrees of commonness in the hospital, but things that we really would be able to coach people through, showing our residents, demonstrating the best practice, and then getting them to wear the glass and either have intraprocedural coaching or the kind of feedback that we've never really been able to give before. So they record the procedure as they do it, and immediately thereafter, we sit
See it.
down and we look at the videotape and we
Absolutely.
figure out what did you do right and what did you do wrong and what are you going to do differently next
Right.
time. So
Has
it's the best kind of feedback.
yeah, has Google offered to fund any of that research?
Well, we have just started to talk to them about it.
I would think they'd have an
I have,
interest.
I would think so too, but to date, and I want to make this clear because I think this is important. I haven't received any research funds for the work that I've done. I've paid out of my own pocket for the device. The speaking that I've done about it has not been paid for by Google. It's all been sort of part of this exploration that I've been doing on my own. So I like to say that, I have like the reverse disclosure slide on my
You're paying them.
presentations where I'm actually paying Google.
That's a good disclosure. That's good. Very
So,
nice.
but we're really hoping that Google is going to find what we're doing interesting. One of my partners, he and I actually did a live hangout during this talk that I did last week in New York, where he was doing a hernia in Seattle, and I was standing on the stage with my laptop, and we did this live Google Hangout, and it didn't work nearly as well as the example that I explained earlier with the trainee and the model and the mannequin,
Right.
because the fidelity was not nearly as good. And I think the audience appreciated that this is still very early and it's not ready for prime time, and we're not using it clinically. There's a long way to go before we're going to be able to have that degree of reliability, but there are people out there that are working on this and are dealing with the HIPAA and security issues. And I think that the sky is just the limit when it comes to this device, how we're going to be able to incorporate it into medicine and surgery.
Well, I congratulate you for being an early adopter. I think that's really cool, and I think it's going to make some very meaningful difference to have some data coming back on the use of these things.
Well, I think that's why we've formed this research group is that, our first meeting was just last week, and we were sitting around and saying, okay, well, we're going to do this abstract and we need to do this project and we need to put this IRB application together. And one of the folks that was sitting around the table said, no, I'm sorry, but we just need to take a step back. Why are we doing this? What is so important about this? What do we hope to achieve? And are we really going to find that this is helpful? And I think asking those really critical questions from the very beginning is exactly why I'm very happy to be a part of this program, because we can't just start using it and say that it's going to make a difference. We have to know that it really will.
Yeah.
And I think we're all very excited about the technology and the possibilities, but until we can show that it actually works, we're not going to be using it on patients.
Right. Right. Well, what else do your colleagues need to know about glass in your research? We can talk again on another day. In fact, I'd love to.
Yeah, well, I'd love to talk more about what we're doing as our research evolves. Like I said, we're just getting started, but I think that this idea of being able to use glass as a trainee's, you're standing over the shoulder of the trainee, and you're really able to see for the first time what they see. That's very exciting. I think the live intraoperative coaching is really another direction that we'd like to pursue, and hopefully collaborate with the group at Michigan. And I think there's also an opportunity for us to do some work in global health, which is very exciting. Even in the state of Washington, if you think about where resources are and where our hospitals are located, there's a huge area in the central portion of the state that is pretty underserved. And I think that the idea of being able to take glass in those underserved areas and do even outreach, maybe not even intraoperative work, but just being able to lend a hand where there really hasn't been a lot of support in person is going to make a big difference. And you can imagine that, that certainly could be extended outside the country,
Sure.
across the oceans. And so there's a lot that we can do.
The
And I'd love to
possibilities are endless.
they really are. They really are. It's an exciting time, I think, for medical education, and I think it's an exciting time for patients too, because this idea that this information doesn't belong to the hospital, doesn't belong to the electronic medical record, but rather it belongs to the patient is kind of ironically a new idea. And one of the examples that I gave in the talk that I gave last week was that this could be really a personal health record. I took my son to the pediatrician and I brought it along with me, and he'd sprained his ankle. And so we got an x-ray, and I just took a picture of the display right there in radiology, so that I now have a copy of his film. Now, it's not the same quality as if I had had the film itself, or the digital image, transmitted to my computer, but it was so easy,
Yeah, I think.
that's what it's all about. It's just right there at your fingertips, right there at your eye.
Yeah, and I think every doctor has some familiarity with the FaceTime or cell phone use
Yeah.
of telemedicine from friends and family.
Well, and I think, my other project, the mobile app, came right out of my own experience as a surgeon. I mean, I'm sure you've had this too, that your patients send you these disgusting wound photos in your inbox, or they text them to you, and it's helpful.
Right.
But then what do you do with them? Where do they belong? Well, they don't belong on your phone, that's for sure.
Right.
So, we're just trying to figure out, where's all this information supposed to be? And I think that's going to be part of the next conversation that we have to have. Once we figure out that it's okay for all of us to share this information, well, where is it going to live?
Once
And
everybody calms down a little bit and we fix the
once
laws.
everybody calms down and we figure out that we're really trying to do the right thing, that it's not
Right.
nefarious, that everyone wants to share this information. In fact, it's really all altruistic, and
Right.
it's all about helping people.
Right. Well, thanks so much for talking to the Op Report, Dr.
Oh,
Heather
it's my
Evans.
pleasure. Thank you.
And we'll talk again soon, I hope.
I hope so too. Thanks a lot.
Thanks for checking out the Op Report. Help us keep conversations alive on topics in general surgery. Check out more episodes of the Op Report and other OnSurge content here at YouTube. Find us at Facebook. Follow us on Twitter. And find our homepage at onsurge.com. Join the conversation and tell us what topics you'd like to hear about and what people you'd like to hear from.